to talk about something that honestly costs med spas way more than they realize, and that's hiring injectors who don't stay. And I'm not talking about the bad hires. I'm talking about the ones where you're excited, they interviewed really well, they feel like such a great fit, and then a few months in, something shifts and changes. Either performance dips, engagement drops, or you're just getting that feeling like they're just not fully in it anymore. And before you know it, you're either replacing them or you're bracing for it. So the tricky part is it doesn't show up right away, right? It's not like day one red flags. It's subtle. It's the slow disengagement, the inconsistency, the lack of buy-in over time. The reality is that's almost never a skill issue. That's a misalignment issue that started in the actual interview. Angela, I feel like this is where people think they nailed the hire, but actually missed something a lot bigger.
Yeah, absolutely. And we see it a lot, right? We have so many conversations with injectors and practice owners alike, because most of the time, these injectors can do the job. They can inject, they can sell, they've got experience, but none of that tells you if they're actually going to stay and grow with your business. And I think the biggest mistake we see is people interviewing for personality and experience, which is so important. Those are great things to look for, but not necessarily looking for the behavior patterns in the history of their employment or what they're telling you and how they're saying it. Because interviews today are very polished. Candidates know what to say. They know how to say the right things to sound motivated, to sound like they're a team player, or that they're looking for a long-term home. But those answers don't really tell you how they handle frustration, how they handle slow growth, leadership differences, or unmet expectations. And those are the moments that determine whether someone stays or whether they start looking elsewhere.
Exactly. So, what we want to shift today is how you think about interviews. Instead of asking, do I like them or do they seem motivated? We want you thinking, what patterns are they showing me? Because long term loyalty isn't a personality trait, it's a pattern of decisions. How they've handled past environments, what made them stay, what made them leave, what they need consistently, that's what actually predicts what they'll do in your business long term.
Mm-hmm. So one of my favorite questions to recommend is, and you can incorporate this into your interviews, is tell me about a time you almost left a role, but then decided to stay. And I love this because it forces a real answer. They can't stay surface level. They have to think about a specific moment, an example of where something maybe wasn't working, didn't feel quite right. It's not a yes or no question that they can just sugarcoat or gloss over. It requires a substantive answer with detail and those specific examples. What you're really listening for here is what did anchor them ultimately? Was it the compensation? Was it leadership stepping in? Was it a new growth opportunity presented to them? Was it feeling valued or recognized when they really got down to and thought about it? Was that something that they did feel within that practice that led them to stay? Or was it more opportunities for training or leadership? Because whatever made them stay in that moment, that's what's going to matter in your practice too. And if their answer is very surface level or they struggle to come up with one, that's information too. So you're not only listening to what they are saying, but sometimes what they're not saying, or what they're not able to convey at all. So it usually will mean that they will either leave quickly or they haven't really reflected a whole lot on what does keep them engaged long term, which also tells you something.
Yeah. And then this is where I take that question one step further. I'll ask, what would have pushed you to actually leave if they actually ended up staying? Because now you're getting both sides of it. You're seeing what keeps them and what loses them. And this is where a lot of owners have a moment where they realize we might not be able to give this person what they need long term. And that's not a bad thing, everyone. It's really not. It's actually really valuable clarity because hiring someone you like but can't retain is way more expensive than passing on someone who isn't the right fit long term. And I think this is where people get into trouble. They override what they're hearing because they like the candidate or need the role filled super quickly.
Yeah, we see it all the time. Another really great question is, what does a workplace have to do consistently to get right for you to stay long term? And the key word there is consistently, because most people can tolerate something short term, a little blip in the radar, but long term is where misalignment really shows up. And when they answer this, they're basically giving you their internal checklist. It might be communication, leadership style, structure, autonomy, um, you know, uh, really respecting their clinical expertise or growth support. And none of those answers are wrong, but your job is to ask yourself, can we realistically deliver on this consistently? Because if the answer is no, it doesn't matter how great they are, they really just won't stay. So this is exactly why we developed our injector retention checklist, because these patterns come up constantly. We hear it all the time, as I said before, and most people don't have a structured way to evaluate them. So if you want that checklist, just comment retention in the chat and we'll send it over to you.
And this is where I also see people make emotional hiring decisions. They connect with the candidate, they're really excited about them, and they kind of ignore what they're hearing. But if you can't realistically meet with what someone needs to stay, you're not hiring for retention, you're hiring for replacement. And that's the cycle a lot of med spas get stuck in: hire, train, ramp, lose, repeat.
Mm-hmm.
And it's exhausting and it's super expensive.
Yeah. You get in a cycle where you're just filling a role, you're not hiring for longevity, and that's painful, honestly, for practice owners. Okay, so this next recommendation is huge, and not enough people ask it. How do you handle slower growth periods in your injector career? Because let's face it, everyone's happy and loves aesthetics when they're busy and making money. Everything's great, all rainbows and butterflies. But there are always slower periods, especially when someone is new to the practice and building their clientele. And this answer tells you everything about their mindset. Do they take ownership? Do they stay consistent in efforts of what they can do to continue building? Do they lean into learning and growth? Or do they immediately start thinking about leaving? Do they blame the practice, the marketing, all of that for being slow or not doing enough? Or can they give examples of how they've jumped in to do their part in growing their clientele and creating and building that loyalty among their patients? Are they giving you clues about whether they're going to bail when the going gets tough or whether they'll contribute and do what's necessary to continue growing? Because that is usually a pattern, not just a one-time reaction.
It's so true. And if their answer leans toward, I'd probably look elsewhere, again, not necessarily wrong, but now you know their default response to discomfort is to leave. And that's something you want to know before you hire them, obviously, not after. And honestly, this is why we are so big on retention strategy here at Diamond Accelerator as a whole, not just hiring. So if you don't already have what Angela was talking about a little bit earlier, our injector retention checklist, comment retention in that chat and we will make sure we send it to you. It'll help you actually apply all this stuff that we're talking about so you're not just having good interviews, you're making better long-term hires.
Yep. Another great question to ask, and actually two questions, but they're related. What does a great patient experience look like to you? And how do you build long-term relationships with your patients? And their answer should align with your philosophy, at least mostly, whether that's natural results, education first, luxury service and experience, being an expert, following up with patients regularly, and building long-term treatment plans. Any or all of those are kind of the things you're looking for to see what aligns with your philosophy and your patient experience. And injectors who value patient retention tend to value job stability too. They should want to build patient loyalty and help strengthen those relationships. If they're only about what happens in the treatment room when they have the needle in their hand and they really can't speak to anything outside of that, or they just don't seem as interested in that, they're probably not invested in the bigger picture or long-term growth.
And they're probably just saying what you want to hear, right? So another couple questions that I love that you can choose whichever way you want to phrase it is, what skills are you hoping to develop over the next few years? Or what do you see as the next steps in your career and growth as a provider? A strong answer is going to show intention, curiosity, and clear commitment to growing within aesthetics, not using it as a temporary spot. You're listening for whether they've really thought about their future in this field and whether they're already taking ownership of that growth or not. The best candidates will talk about advancing both their technical skills and their clinical judgment. For example, they might mention wanting to deepen their expertise in injectables, refine facial balancing techniques, or become confident in full face assessment rather than treating isolated areas. They may also bring up interest in learning more advanced procedures, staying up to date with new products and technologies, or attending trainings, conferences, or certifications on their own initiative. Just as important, strong answers often go beyond hands-on skills. Look for candidates who mention improving patient consultation, communication, and building long-term patient relationships. Aesthetic medicine isn't just about performing treatments. It's about understanding patient goals, setting realistic expectations, and delivering consistent, thoughtful care. When they talk about next steps, the most compelling responses usually reflect a desire for progression within the field, whether that's becoming a highly skilled injector, taking on more mentorship roles, contributing to training, or growing into leadership positions within that same practice. That shows they see a future here, not necessarily an exit. On the other hand, if someone isn't putting much thought into their development or only gives vague answers like getting more experience, it can be a sign of honestly not being fully invested into the role. Similarly, if their goals lean towards leaving aesthetics altogether in the future, that's worth noting. Ultimately, you're looking for someone who is proactive, self-motivated, and genuinely interested in building a long-term career in this amazing industry. Someone who's already thinking about how to grow, not just waiting to be told what comes next. All right, so in a bit, we're going to open up for questions from the audience. But before we do, we pulled together some of the most common ones that Angela and I get all the time. And you're probably thinking about them out there in the audience. So we're hoping to read your mind. The first one, what if someone hasn't stayed anywhere longer than a year? I always want to understand the why behind this. Don't look at short stays as automatically a problem, but they do tell a story. And it's our job to really listen to what that story is. And are they making intentional moves to grow, gain better training, or get closer to the kind of provider they want to become? Or do the same issues seem to follow them from one role to the next? And are they leaving before there's a real opportunity to work through it and grow from these challenges? Or is the going get tough and they bolt? Because patterns matter more than timelines. If every move shows clear progression and purpose, that can make an actual positive in this situation. But if the reasons are vague, inconsistent, and there's a pattern of blaming external factors or other people, then that's where it starts to raise some questions. I also pay really close attention to how they talk about these experiences, the infliction in their voices. Do they take ownership as well? Can they reflect on what they've learned, even in less than ideal situations? Or does it feel very reactive, like they're always trying to get out of something rather than grow through it? When you start to hear the same themes repeated without much self-awareness or accountability, that's usually where concerns will begin. Because at that point, you're not just looking at one short-term role, you're seeing a pattern that could absolutely continue at your med spa. And naturally leads to another question that Angela and I get all the time as hiring consultants. Take it away, Angela. What is it?
Yep. What are some of the red flags to look out for? And there can be many. Some of them might seem very obvious, but again, usually it's subtle hints throughout an entire conversation that you're looking for. The ones that are very obvious, I would encourage you to just dig deeper, ask a follow-up question, ask for clarification before you assume, that they meant the worst and meant to raise that big red flag. But one red flag is when everything that they're saying is focused on them. If it's just their goals, their schedule, their growth, what they want. And of course, these things are important, and you want to know that as a business owner, of course, so that you can make sure you're aligned. But if there's no mention of team, patients, or how they can impact the business and help the practice grow and what they also bring to the table from a culture standpoint, that's a red flag. So really, really dig into that a lot. Other things to look out for are if aesthetics is just a temporary or side role for them. This can be okay. We do see it when an injector is just starting out. Typically, is it's not easy to get their foot in the door, and they have to start somewhere. So they might maintain a role, at the hospital or primary care or something like that while they're getting that experience built up. But here's where I'd go back to the reason it's been temporary or a side gig for them. Are they really passionate about it? Have they been taking steps otherwise to grow into more advanced skills and commit to it more eventually, but still kind of having the security of some other role? Or do they approach it like a side gig where it's just sort of something they do? So if it seems like they're afraid or hesitant to take on the bigger commitment because they're afraid it won't work out, that can be a red flag, absolutely. If they show little interest in ongoing training, to reiterate and expand on something Kristin, mentioned a little while ago, complacency in an injector is a huge red flag in this industry. Techniques evolve, new products come along. If they haven't shown an interest in adapting their skills over time, that's a red flag. If they're vague or non-committal about future plans, again, not really showing that they're looking further out, they're really just focused on today and what can be done for them today, or they're not really thinking of what they want their career to look like in 3 years, 5 years, and hopefully that includes your practice in their plans. If they do have a history of frequent job hopping without clear reasons. So it's really easy to look at a resume and go, oof, they were less than a year at the last 3 or 4 places they worked at. I would still have that conversation with that person. And I would just make a note that I definitely want to tackle that issue with them and understand why, and see if there are good, valid reasons for that, or if I feel like they're glossing over something. And to me, one of the biggest things that you really, really want to uncover is the reason that they got into aesthetics in the first place. If they talk about that, it was convenient for them, it worked better with their desired schedule, it seemed like it would be an easy way to make more money or have less stress. We all know that's not necessarily the case, especially for an injector starting out. It's really hard work and a grind to get there, but it is such a great industry. Or they wanted to just get away from the grind of the ER or clinical medicine without also demonstrating that they're passionate about aesthetics and maybe hope to transition fully into it eventually. If it's really just about the logistics and, sort of checking box that make their life more convenient, that's a big red flag, and you must dig deeper into that. So it sounds obvious, but if you're not feeling and hearing passion as their number one driving force and wanting to help people look and feel their best, or something deeper, something more than just that convenience and logistics, they may not be committed to the industry, let alone to your practice.
So true. And then here's the big one. I know you're all thinking it, so we're going to try and answer this for you. Can you teach loyalty? Everything we're talking about today, can we teach loyalty? Obviously, not in a way like you can teach a skill like math or writing. You can't force someone to feel loyal, and you can't demand it into existence either. Loyalty isn't something people adopt just because they're told to. It's something that they choose based on their experience. But here's the important part. While you can't teach loyalty directly, you can create an environment that either supports or completely breaks it. So people tend to become loyal when they feel respected, valued, and consistently treated with fairness. When trust is built over time through honesty, follow through, and clear communication, loyalty starts to grow completely naturally. It's a byproduct of how people are treated, not a rule that they're expected to follow. On the flip side, even small amounts of inconsistency, lack of recognition, or broken trust can quickly erode loyalty. It doesn't usually disappear all at once. It fades when people are either feeling overlooked or unsupported, or just clearly not recognized. So the question isn't, can you teach loyalty? It's, are you creating the kind of environment where loyalty has a reason to exist? Because when you do, you don't have to ask for it. It shows up completely on its own. So, all right, now we would love to hear some questions from you guys. So if you want to drop some questions in the chat, we will go ahead and check those out now. Angela, do you see any coming up?
Um, yep, I see. What's one thing that separates a good candidate from a great one?
Ooh.
That's a good
Ooh.
one. Do you want to take that?
Okay. A good candidate can obviously perform all the technical skills that you are looking for. A great one, though, brings the consistency, that self-awareness, and genuine commitment to growth that we've been talking about. So, not just their own career skills are important to them, but the whole practice and everybody who is on the team. They don't just focus on what they're doing, they focus on how they're doing it as well. And they communicate with the patients and how they handle feedback. That's a huge part of it. If they're not receptive, that makes it really hard. So if they're not wanting to be developed within their role, that tells you something too. If they're very stubborn, they're not a team player, and you're going to either have to manage around it or manage through it, and that can be very micromanaging.
Mhm.
So I would say definitely great candidates are going to be your proactive type, not the reactive type. It's a
Okay.
great question. Put us on
No
the spot.
problem.
Yeah. Okay, I think I see one. How can you tell if someone is truly coachable? Great question. Take it.
Okay. I would say look at how they respond to feedback, right? That initial kind of coaching or correction, if you will. If they get defensive or do they get curious? Coachable people realize they're not perfect and there's always room to grow. They might ask follow up questions. They apply what they've learned and then they come back better the next time. They are completely open to that constructive feedback and making change for themselves. So they don't just hear the feedback, they implement it. And you can also hear it in how they do talk about past experience. And when we're talking about identifying that in the interview itself, if they can reflect, take ownership, and articulate what they've learned, that's a great sign. Now, there's a fine line here as well because we want injectors that are confident, that speak with authority, that come across as the experts and know all the things. But sometimes there can be ego involved, and so you really kind of have to dig into that too and decipher is that confidence or is it cockiness? Are they going to be open or do they know everything or think that they know everything there it could possibly be to know and that we're not going to be able to grow together? So that's something just I would have more conversation about to see if there's something there and whether they can grow with you.
Well said. Yeah. Obviously, we get these questions a lot, so we're somewhat prepared for these type of answers. Okay, Angela, do you see anything else?
um, how do you identify someone who will stay long term?
Oh,
Kind of.
well, okay. First and foremost, you're going to listen for alignment. You're going to both be on the same page. Do they share goals that match what your practice can realistically offer as well? Are they excited about growing within this field and this type of environment that you've created? Longevity usually comes from shared expectations when both sides are clear on what's going on and what's going to happen in the future. So you can't necessarily identify it right away, but there's little things that you can do and ask and mannerisms that you can pay attention to really see if this is somebody who's going to be long term with you or not. And the other thing, we're going to say it again, that we worked so hard on, you guys. If you haven't commented retention in the chat yet, please make sure you do because the injector retention checklist, I am telling you, this is your last call to get it. It really is helpful, and we've put a lot of time and effort into really assisting you guys. So utilize the resource because, man, it should make your life a lot easier. It'll help you really assess how you approach recruitment and hiring and your injectors retention and all of that, what your strengths are, what your weaknesses are. And when it comes to fostering a long-term loyalty with your team and getting that together, this is going to make sure that you're checking literally all the boxes. So retention in the chat, that's what we need.
Hopefully, you guys were taking really good notes and writing down every single question that we were recommending so that you can dig deeper into these issues and concerns and get on the road to kind of creating that long-term loyalty from injectors. Do we have any other questions, Kristin, before we wrap? Didn't see anything in the chat.
Let me see here.
Anything else? Oh.
Well, I want to say hello to all the people who are watching. Thank you so much for joining us. We absolutely love when people take time out of their day to spend some time talking about recruitment and hiring. So thank you so much for being here.
Mhm.
I don't think I see anything else.
Yeah, I
So,
think we're good. So, well,
yeah.
thank you so much for joining. As Kristin mentioned, if you love this training, make sure to share it with your team or another med spa that could benefit. You can always catch the replay on our YouTube channel. So if you didn't jot down all of those questions as we were saying them, you can go there. And to get access to more free training that will help you grow your med spa, visit our link tree in our social bio and be sure to join us live right here every Wednesday, 2:30 Central time, same place, Instagram, YouTube, Facebook, and LinkedIn. And we'll see you next time.